So for us to give you an overview, first of all, of Alzheimer Europe, for those of you that may not be aware of the organization, and also just a lot of the kind of this morning's meeting was around looking forward about all the kind of exciting research that is currently being done. But as an organization that has been involved in campaigning to get dementia recognized as a priority, I also just wanted to look back for the last maybe 10 years and really celebrate where we are today, because it's been a long way which led us here. And I think that very often we forget to celebrate our achievements by only focusing on what we need to do in the future. So hopefully what I will be able to do is share some of the enthusiasm that we as a patient organization feel when it comes to where we really are as Europeans and the field of dementia research. And I will end my talk with some suggestions on where we believe that this European research collaboration should go in the future. So basically, just for those of you that may not be aware of Alzheimer Europe, so we are the European umbrella organization of national Alzheimer's organizations. This would be our map of Europe. So we have 39 organizations from 34 different European countries. All of these are normally the representative national Alzheimer's organization in their country. You will see that it's not quite the same as the European Union. There are some countries missing, which are the current Baltic states, but we also have a number of countries like Israel, Turkey, Bosnia-Herzegovina, Iceland, Norway, Switzerland, that are actually involved in our organization as well. So what we have been trying to do, and I think hopefully I'll be able to show you that we've been doing that quite successfully, is really trying to make sure that dementia is recognized as a European priority. Our work in that field really started in 2006. We met as organizations in Paris and we adopted our not very uniquely named Paris Declaration. But the idea was really having a kind of policy program or political program that when we meet policymakers, what we would like them to change when it comes to the recognition of dementia, first of all, as a major public health program or health priority. Also that each one of the countries in Europe should start developing national dementia strategies or action plans or Alzheimer's programs, however you would like to call them. But also at that stage we really felt that dementia research was still an underfunded area of research, and we wanted bigger and more funding for Alzheimer's research at a European level. We also felt that even at that time that it wasn't just a point of increasing funding, but also making sure that the funding that is allocated is then better coordinated and that we have really better coordinated research collaboration between European countries. The reasons for that, and I think Craig will go into more detail about some of the scientific challenges that research really wants to address. What I'm going to talk about is more the kind of public health impact. Age is really the kind of key risk factor for developing dementia, and as you grow older, your chances of developing one form of dementia or another is actually increasing. According to some statistics, by the age of 95, 1 in 2 women are actually likely to have cognitive deficits to a point where it could be classified as dementia, and men would be about 1 in 3 men over the age of 95 would have significant cognitive deficits that could be categorized as dementia. And overall in Europe, we would estimate that currently there are 8.7 million people living with dementia in the European Union, and these numbers are, of course, because of population aging, expected to at least double by 2050, and depending on the countries, treble in some of the other countries. As an organization, we also carried out a survey together with the Harvard School of Public Health and our colleagues from the US Alzheimer's Association to really get a better understanding of what the public perceptions are about Alzheimer's disease. And one of the questions that we addressed was, well, how familiar are you with people with Alzheimer's disease? Or actually it was people with Alzheimer's disease, it wasn't people with dementia that we asked specifically about. So this was a survey, a public opinion survey, which was a representative population sample. We did that in 4 European countries, in France, in Germany, Poland, Spain, but also in the US. And we asked people, first of all, do you know somebody that has Alzheimer's disease? And we were really surprised that between half and 3/4 of the population actually know somebody in their environment or in the neighborhood that has Alzheimer's disease. We also asked the question, well, do you actually have a family member that may have Alzheimer's disease? We didn't ask, or we didn't specify what we meant by family member. So this could be a spouse, it could be a mother, father, it could be grandmother, it could be a distant cousin, or whatever the person that was asked that question meant. But again, we were really surprised to see that in the US it was 40% of people had a family member with Alzheimer's disease, and in the European countries, with the exception of Poland, it was around 1/3 of people did say that they had somebody in their family that had Alzheimer's disease, and Poland was slightly the outlier, where it was only 1 in 5 or 20% of people that said that they had somebody within their family with Alzheimer's disease. So if you add that, so you have 8.7 million Europeans living with the disease, but the numbers of people affected by the disease, the family members, children, grandchildren, spouses, of course, would make that a much, much bigger number and an even higher priority for researchers. In the same survey, we actually also asked, well, what would be the diseases that you would be most afraid of? And this wasn't a survey about Alzheimer's disease, where at the very, very end, we asked them, oh, by the way, which one of the diseases are you most afraid of? This was the very first question that was asked in the survey, so as not to already gear people towards answering Alzheimer's disease. But what was very clear is that in all European countries, with the exception of Poland and the United States, Alzheimer's disease really has become the second disease that people are most afraid of after cancer. Other diseases such as stroke or heart disease or even diabetes and other diseases were much further down the list of diseases that the population said that they were particularly afraid of. So this is some of the reasons why we believe that Alzheimer's disease should be a priority. So we started our work in 2006 to really get this recognized by policymakers, both at a European but also at a national level. If I had presented this map at that time, there would only have been one country, which was France, that had a very modest Alzheimer's strategy already in 2006, but in all other European countries, there was really no recognition that this was a key priority that countries should really be dedicating their efforts to. So since then, this is a map that we more or less have to update every 3 or 6 months, because new countries are joining the list of European countries that have really recognized dementia as a priority and have also developed either a national dementia strategy, an Alzheimer's program, or in some countries, a strategy for neurodegenerative diseases. So the countries with neurodegenerative diseases would be Spain and France at this stage, but you also have a whole range of countries that really have very comprehensive dementia strategies. So that's the case in the UK, with separate strategies for the constituent parts of the United Kingdom. In Ireland, the Benelux countries, France, Netherlands, and Belgium, Netherlands, and Luxembourg, but also in some of the Nordic countries like Denmark, Norway, and Finland as well. Also some of the Mediterranean countries, so you have strategies now in place in Italy, in Malta, in Cyprus, in Greece, but also even Israel has currently a dementia strategy. So it's really an area where we can see real recognition of dementia as a priority for national health systems. What we were also particularly proud of is that Alzheimer's disease has remained a very high priority also at a European level. So there's been a number of EU presidencies, so that kind of rotating presidency of the European Union, which dedicated some kind of high-level policy exchange or ministerial conference on Alzheimer's disease. One of the most significant ones was absolutely in 2008, where it was President Sarkozy who really launched a number of these initiatives that I'm going to go into more detail later on. But a lot of the kind of current ongoing initiatives really date back to 2008 and that very first EU Presidency conference on Alzheimer's disease. And it really shows that it's not just politicians coming to Brussels and having, or going to Paris, having interesting discussions and having interesting meetings, but these meetings and discussions really lead to very important policy developments and changes for the people that we are trying to represent. And in the last 2 years, you can see that almost successive presidencies, so it was Italy, Luxembourg, the Netherlands, and the Slovak presidency, all dedicated a public conference on the disease, but also the Luxembourg presidency reached some very far-reaching conclusions on how the kind of collaboration between member states and between ministries of health should really be improved in the future. So again, really something that we are quite proud of to see, that this is something that isn't just recognized at civil servant level, but it is health ministers meeting and making sure that this is a subject that stays on the European agenda. Another way that European ministers of health are trying to collaborate and work together is called European Joint Actions on Dementia, and basically they have understood that each country is facing very similar challenges at a national level, that some of the solutions that they are working on are probably very similar and may actually be exported to another country. So the idea would be that ministries of health are collaborating together, bringing their civil servants together, bringing academics together, trying to understand what policy initiatives exist at a national level, but really then help or try to identify what are the good practices that exist, or maybe some of the best practices that should really be promoted not just in one country, but much more broadly across Europe. So there's 2 of these joint actions that have already started. So the first joint action was from 2011 to 2013. It looked at timely diagnosis. It looked at the prevalence of dementia in Europe. It looked at what kind of support systems are in place at a national level for people with behavioral and psychological symptoms of dementia, especially in a home setting, and what exists to support these people. How can we go about reducing the use of antipsychotics in nursing homes? And also, what can we learn from advanced directives and competence assessment? So how can we make sure that people with dementia, at a time when they are still able to make decisions for their later life, how can they express those wishes through advanced directives or other ways? So that was the ALCOVE project from which lasted for 2.5 years. And just last year, a new joint action was started, which is coordinated by the Scottish Government. And again, they are looking at issues like timely diagnosis and post-diagnostic support, crisis coordination and care coordination. They're looking at the quality of residential care, and they're also looking at how they could spread the idea of dementia-friendly communities between or from one country to another. What we are also really delighted to see was that Alzheimer's disease stayed an absolute focus of research under the 7th Framework Programme. So brain research was identified as a priority according to my sources in the European Commission, and I hope that the Commission representative is not going to contradict me there, but over 300 projects were funded in the field of brain research, of which 555 million were for dementia and 327 million euro were for Alzheimer's disease. One of the big achievements as well was that under the 7th Framework Programme, the Human Brain Project, and you have representatives here today, were launched also under that Framework Programme. It's really one of the kind of European flagship initiatives, which is granted with 100 million euro annually, so really a very significant investment from the European institutions for overall brain research. And we're delighted as well to see that it wasn't just a priority under the 7th Framework Programme, but it also continues as a priority as well under Horizon 2020. Then, of course, there's also the JPND, and a number of you may have heard of that. So that's the Joint Programme for Neurodegenerative Diseases Research. It's not a purely European funding mechanism, because what they have tried to do at a European level is identify a common vision, identify a common strategic research agenda. We have 30 countries from Europe that are participating, but there's also countries like Australia, Albania, Canada, Israel, Norway, Switzerland, and Turkey that are also participating in this European program. So they are defining a number of priorities that should be funded, but the funding is decided upon at a European level. The evaluation of the project is being done at a European level, but the funding comes for British researchers comes from the UK, for French researchers comes from France. So it's a kind of a mixed model where decisions are being made at a European level, but the funding is still a national level. And just for the period between 2011 and 2014, there were 15 projects, for example, that were funded for a total amount of 68.5 million euro. And I'm leaving the best till last, and I'm not saying that just because I'm here at the IAME office. I really also believe that it's, first of all, it's a public-private partnership, and dementia and Alzheimer's disease were really recognized as priorities of both IAME 1 and IAME 2. You see around this table all the researchers that are involved in different European projects, and this is just a part of the researchers that are involved. Serge van der Geyten, when he gave his presentation about the EPAD project this morning, said that just in EPAD, over 220 researchers are collaborating as part of the EPAD project, trying to find solutions and trying to help with the prevention of Alzheimer's dementia in the future. So it's a huge funding that is really being made available, and I hope that I have to say I'm incredibly impressed by the work that's being done by IAME, and I hope that you as collaborators in IAME should really be fantastically proud of the achievements that you have been able to make. So the funding in the first funding period was 168.8 million, which is funding which comes, of course, from IAME, but also from FBI companies in kind. 4 projects that were presented, but I think I'm going to leave that to some of the other researchers, and I think Craig also has a slide which goes into a bit more detail about some of these projects. Also, under IAME 2, we have already a whole range of projects that have been funded, and the overall funding is amounts to 86.7 million. Again, very considerable sums of money, which really hoping to benefit people with dementia and people with Alzheimer's disease in the future. So you could almost think that looking back and looking at all the achievements that the work is done, and we should really be happy with everything that's being carried out at the moment. But unfortunately, of course, I can present this as the glass is half full or the glass is half empty. And of course, there's still a whole range of things that we need to change and maybe improve when it comes to the way forward. Alongside all these kind of national dementia strategies, what Alzheimer Europe and our national organizations would really like to see is the development of a European dementia strategy, which would focus on the one hand on research, but also on the other hand around care approaches and exchanges of good practices between member states to really make a difference for people with dementia and their carers. I've mentioned a number of research initiatives that are happening at a European level. Again, from a kind of outsider's point of view, we really feel that it would make sense for some of these research initiatives, instead of generating new mechanisms for funding, that we should really start communicating and coordinating those efforts much more than we have done in the past. Also, just this morning we had all these researchers presenting the different projects that they were involved in, and they saw that there was an awful lot of opportunities for them to collaborate with one another, to learn from one another. So maybe there's also some mechanisms where it would just be funding these kind of exchanges, which would be really helpful, so that researchers can learn from one another and making sure that we do not duplicate all our efforts again and again. You're not surprised that as a representative of Alzheimer Europe I'm here, and I'm hoping that you would see that all these projects would also see the full involvement of people with dementia, carers, and of Alzheimer associations in those projects, not just in the dissemination of these projects, but also in the setting of research priorities, identification of research methodologies, and even in the kind of conduct of clinical trials, what are accessible and useful methods, how to engage and continue to involve research participants or people with Alzheimer's disease in those initiatives. I would also like to see and hopefully continue to see the leadership that Europe has already shown at a kind of global level, so that initiatives like IAME and JPND should continue to show that leadership also in initiatives at a WHO or an OECD or G7 or G20 level. And last but in no ways least, most of the kind of researchers around this table are looking more at biomedical research, clinical research, and of course we are fully supporting this drive towards finding a cure or prevention of Alzheimer's dementia in the future, or preventing Alzheimer's disease in the future. But we also believe that we cannot forget the millions of people currently living with the disease, and we need to find ways of both giving hope for future generations that this is a disease that may be prevented and cured in the future, but also a disease that if you're currently living with it, there are ways in improving your quality of life and making it possible for you to stay active as a full member of our society. So our slogan would be Cure Tomorrow, Care Today, and I do hope that that's a slogan that would be acceptable for a lot of the researchers here as well. Thank you very much.